Hello family, it's been long since I last did a health awareness video, but I've noticed it really helps one or two people, this health awareness video. So today I'm going to talk about a condition that I will call the HIV of today. Zimbabwe has done exceptionally well in preventing and controlling HIV. That is the real HIV. But today we are faced with another HIV that I will say HIV in quotes. This condition, the unfortunate part of it and why I call it HIV of today is because it's killing lots of people, and it can stay in the body for years and years without someone noticing or knowing that they have this condition. Number three is that according to a board, or they say, this board says 73% of people who have this condition are not aware that is in Africa. It is the highest rates in the world. What is this condition? It's called diabetes mellitus. So it's according to the International Diabetes Federation, we say 73% of Africans who are diabetic are not aware. That's how high it is, and it will be eating us inside, causing complications. Today's just an introductory video. I want to explain what diabetes is. So I'll start with what happens, the process that happens in a normal person, or rather not a normal person per se, but in somebody who doesn't have diabetes, so that we understand what happens in a diabetic person. So in somebody who doesn't have diabetes, let's say for example it's me. I eat sadza, I chew it obviously and then swallow it into the stomach. Because in the stomach it is digested into much smaller particles. These particles, they get into the intestines, and in there they then move, or they are absorbed to the blood vessels. Now when they're absorbed into the blood vessels, it's no more sadza, it's now very small particles which are called glucose or sugar. The sugar is the fuel of the body, is the fuel that I'm using as I'm talking right now. So generally, under normal circumstances, the sugar is usually, the blood sugar is usually between 4 and 8 thereabout, or up to 7.8 if you want to be specific, but let's just say 4 and 8. So obviously when someone hasn't eaten for some time, it will be around 4 or 5 thereabout. When the blood vessel receives or absorbs the sugar from the blood vessel, it starts going up 4, 5, 6, 7, 8, going up like that. And then a message is sent. When the sugars starts to going up after eating, a message is sent to a very special organ that's called a pancreas. When it gets there, a report is sent there to say the blood is now received too much sugar than that which it can accommodate. What happens? The pancreas, it sends a guy that's called insulin. So it means the insulin is produced in the pancreas. The insulin is sent to the storage tanks of the body, which are the muscles and the liver. It gets there, it knocks on the gates of the muscles and the liver, and the gates are opened so that the excess sugar in the blood is transferred or is moved to the storage tanks. For what? For, as I'm talking right now and not eating this sugar, I'm going to be using this sugar that's going to be released slowly from these storage tanks. So it means this sugar, it works when I'm not eating. I'll be using this stored sugar. Obviously this insulin will also help in making sure that the excess sugar, or rather the sugar is sent to all the other cells of the body, but mainly they are sent to these storage tanks for future use when I'm not eating. So now what happens to somebody with diabetic? Two main things. Number one, there's what we call type 1 diabetes, which usually happens in people who are less than 30 years, or diagnosed in people who are less than 30 years. In this case, remember I said the sugar started going up, and then a message or report is sent to the pancreas, to this special organ. The pancreas is supposed to be producing insulin, but in type 1 diabetes, these people, the insulin is no more working, or the function that producing the insulin is dead. So, and why? Well, the main way that we think happens is because the body will be fighting itself, and it fights the cells that produces the insulin, and therefore there's no more insulin that's being produced. That is why these people with type 1 diabetes, they'll be injecting themselves a certain chemical, a special chemical, they live on it. What is this chemical called? It's called insulin. So in other words, they are replacing the insulin that the pancreas can no more produce. That's number one. Number two, another type, this is the commonest type, is called type 2 diabetes, which usually happens in people who are diagnosed when they are above 30 years of age. In this case, what happens is, when the message is sent from the blood sugar that we now have too much amount of sugar, it sends to the pancreas sends a guy that's called insulin to the storage tanks. When the guy gets to the gates of the storage tanks, which you have said, the muscles and the liver. The guards who will be guarding or are supposed to be opening these gates, they resist. The gates, they remain closed, and with that resistance, it means the pancreas will send more and more insulin to say, we have now too much amount of sugar in the blood. Can you please open the gates? And there is continuous resistance, and more insulin is being produced. And with that, eventually, that process is what we eventually result in what's called type 2 diabetes, which is almost 90% of the cases. And in that case, that's the people that we give pills. For example, we could have heard of the pill that's called metformin, is the commonest one. So the metformin, what does it do? Among other ways that it works, it also works in making sure that it goes to talk to the guards who will be guarding these gates, that when the insulin gets there, the gates, they allow their gates to be opened, and then the excess sugar is stored in there to be used later. Of course, there are other ways that this metformin will be working. There are also other medications. Now, these are the main two types of, but also another thing that we may need to know is this, that this type 2 diabetes, which usually happens in people above 30 years, eventually this pancreas may also fail. I will explain 3 ways that it may fail. I explained that this is just an introductory video. In future, I will also explain on the signs and symptoms of diabetes, why some people are more prone to diabetes and some are less, what we can do to prevent diabetes, what we can do among people who are diabetic, what can they do to make sure that the diabetes is well controlled, because if it is not well controlled, they are prone to many complications. We'll go ahead to talk about that. So there are many things. This is actually an introductory video which I thought will help many people because of a sharp rise of diabetic patients that we are seeing in Zimbabwe, in Africa. And like I've already said, 73% of people in Africa who are diabetic are not aware that they are diabetic. So it's really a pandemic that we need to face head on.